Hello, it's Kath Berry here from An Apple a Day, Healthy Children Naturally at treatingchildren.com. I'm here with Rebecca Avern and we're here to talk about her new book, Acupuncture for Babies, Children and Teenagers, treating both the illness and the child. So welcome, Rebecca.
Thank you.
Rebecca, tell me a little bit more about what inspired you to write this book.
So over the course of my practice, over the last 20 years, I've treated gradually more and more children. And in the last 5 years, I've treated almost solely children. And having seen how it benefits them, not only in terms of getting rid of their symptoms or the illness which they've come with, but also in a much wider sense, I've just become passionate about more people knowing how amazing acupuncture is for children, and to encourage practitioners to have the confidence to do it. I think it's an area that when most people do their initial acupuncture training, they're probably rightly warned maybe not to treat very young children or children with very complex conditions. So I just really, really want to get the word out there to practitioners and parents, how amazing it can be, and then hope that more children get to benefit from it.
And what sort of children are you seeing in your practice? Who is your average patient that comes to see you for acupuncture?
Well, one of the wonderful things, one of the many wonderful things about treating children is that there is no average patient, more so than with adults, who are, of course, all different. But my day is normally made up of treating some babies, some 6 months old, 1 year old, some toddlers, some preschoolers, some school-age children, and a bunch of teenagers too. So there's a really broad age range, and the kinds of conditions that they come for are also very broad and varied. So some are very seemingly physical conditions, so digestive issues, headaches, bedwetting, but increasingly a lot of behavioral and emotional psychological issues, especially in the older children and the teenagers as well. So
I think that's worth mentioning, of course, is your book, unlike any other book in the TCM 5-element publication sphere, is that your book really does concentrate on teenagers, and I think that makes it unique. What's been your experience working with these older kids, young adults?
So teenagers, it's a funny one because they're not children, but they're not adults. So they're in this in-between stage. And there's an enormous amount of flux going on, often in their external lives, but very much internally as well, as they try and kind of cross the bridge into adulthood. So because there's so much flux going on, there's more chance of things going awry at that time, particularly with the many pressures that teenagers have to withstand these days. But the benefit of that, the good thing about that, is because there's all of this change going on, we have more chance with acupuncture to bring about balance. So if they came a few years later when everything's become a bit more set, then it's often harder to get them better. But there's a kind of opening, and we can optimize that opportunity to help to sort of set them off on the next path, the next bit of their life on the best track, as it were.
Indeed. Let me just and my other question then is around, you mentioned having graduated 20 years ago and being an acupuncturist and more specialised in the last 5 years. What are you seeing changing in our general way acupuncture is perceived, by the community? Have you noticed any patterns that are forming around why treating children is now so important?
Yeah, I think that the kinds of problems that children suffer from these days are often ones that Western medicine doesn't really know how to approach. So, for example, chronic fatigue syndrome, bedwetting, anxiety and depression, food allergies. Western medicine just doesn't really have the tools to effectively treat those. I think that also parents are becoming more and more concerned and circumspect about putting their children on strong medication from a young age. So I think that's definitely a change, that parents are more willing to question giving their children medication. So therefore they look for other ways of treating things. And I think also that more segments of society are now more open to acupuncture. So whereas it used to be something that maybe only the kind of well-educated middle classes would access, I think that its reach has become wider now, and I'm seeing people from a larger cross-section of society, which is really lovely to see, because it doesn't feel right for it only to be accessible to the sort of the upper middle class sectors.
What would be then, in publishing this book and inspiring acupuncturists from around the world to now explore treating children in their practice, what would be the one piece of advice that you'd give them around making that leap of expanding their reach into the younger people in our communities?
Well, I think telling people that that's what they do and that acupuncture can help children is the first one. It seems such a simple thing, but I've heard, adult patients say to me, but how do you treat children? I didn't think children could have acupuncture. So the first thing is just to get the word out there and to talk about it. Going into schools and giving talks is a good thing to do. But just talking to your adult patients. And then as a practitioner, I think that whilst it's important to have perhaps a bit of specialist training and knowledge, ultimately you have to just do it. And you have to do it even when you're not feeling perhaps 100% ready to do it, because like everything, you just learn through the doing. So you have to sort of be prepared to live with the feeling of, oh gosh, this is a bit difficult. I'm not sure what I'm doing here. And that's quite hard for well-established practitioners who've maybe got to the place with their adult clients of feeling like they absolutely kind of know where they are and what they do. So you have to be prepared to sort of go back a bit and be a student again, really. And to persist when things don't go well, because working with children, inevitably, sometimes, it's chaotic, it's a bit crazy. Things don't go according to plan, and you kind of have to live with that and see that as part of the rich pageant of doing it, really.
Well, on behalf of acupuncturists all over the world, thank you so much for the time and energy that you put into writing the book and to sharing your expertise and knowledge. So we really appreciate it. And for anyone that's looking for a copy, that you can find distributions through the Singing Dragon website. So thank you again, Rebecca Avern.
Thanks, Kath.
And do enjoy the book, Acupuncture for Babies, Children and Teenagers, treating both the illness and the child.